Hello, my name is Dr. Leila Iduna. I'm a medical doctor and have been practicing emergency medicine for 28 years. And I recently got into functional medicine. And I wanted to take this time and opportunity to tell you what is functional medicine, how is it different from traditional Western medicine, what are the benefits, and why I chose to switch. So, functional medicine basically it looks at the root cause of diseases. So, whereas in traditional Western medicine, we find a diagnosis and then match a prescription or a pill to it. For example, one for high blood pressure, one for diabetes, one for cholesterol. That is a very reactive kind of medicine. So it waits for the disease and then it treats the symptoms. It doesn't treat the disease. Functional medicine is different in that it looks at the root cause of the disease. So if somebody comes to me and complains of diabetes, high blood pressure, high cholesterol, overweight, and feeling fatigued, I actually look at why the body is reacting in the way that it is. Why is the body symptomatizing or causing illness in the way it is? The body is not created to be ill. It's supposed to work well. So what went wrong? So I look for the root cause, and it may be because they have been taking too many of these medicines and they actually weaken the system, or there is some autoimmune problem going on. And then we look as to why there is an autoimmune problem. Why is the body fighting itself? So we don't just give a pill for the autoimmune problem. We have to look for why the autoimmune problem is there. And it could be because the patient is nutritionally deficient, or the bacteria in the gut are imbalanced, or a patient has a toxic exposure. It could be a lot of disease, some chronic standing illnesses like Lyme disease or Epstein-Barr virus. All of those can cause inflammation, which the body can manifest in then various diseases. So we look at that. Now, why doesn't traditional Western medicine do that? Why does it have to be a whole different branch of medicine? I don't know why it doesn't look at that, but I know that I wasn't taught what I'm doing now in any medical school or in any of the residencies. I actually did 2 residencies in internal medicine and in emergency medicine, and I wasn't taught that. I actually had to go back and find more training through the Institute of Functional Medicine, which teaches doctors how to specialize in this kind of medicine. I studied with them for 5 years and took their exam, and then now I'm able to practice this because I learned enough to do things differently. So what's different in functional medicine is it actually looks at the biochemistry of the cell in a much more deeper way. And these tests are done by blood test in a lab, but we don't do them in a traditional practice. For example, if a doctor is concerned about a thyroid problem in a patient, they would only do a test called TSH, or sometimes they would do a T3 or a T4 level. But there's another test that needs to be done to see if there's enough of the active thyroid hormone to sustain the body. And we don't do that in traditional medicine. Again, I don't know why, but it's not done. We don't usually look for markers for Hashimoto's. It's only as a secondary or a tertiary workup that we would consider that. For functional medicine, we look at all these from the get-go. We look at nutritional status. We check nutritional levels. We check levels of inflammation markers. There are blood markers or serum biomarkers, which can clue us into if there is any damage to any vascular disease. There are markers for hormones that we can look at and see if somebody is complaining of fatigue and they're over 40, what are the hormones doing? So these are all the different things in functional medicine. And then there's a whole different approach to treating them as opposed to traditional Western medicine. So this is more a preventive way. So it picks up things very early. For example, we look at the level of insulin in the person, and not just a blood sugar level or even a hemoglobin A1C. Some of you may be familiar with that. Those are actually late markers of diabetes, but if a person has a high insulin level, they're heading towards insulin resistance. And that's how functional medicine prevents the disease or looks at it at a very, very early, even before the disease manifests, that we can pick it and treat it and prevent the long-term consequences of these chronic illnesses. So that's what functional medicine is about, and I hope that this was helpful to you.